I'm Dr. Macular, and today I will discuss age-related macular degeneration. How is the patient going to present in this case? The presentation of the patient, of course, can be vision loss. The vision loss is going to be gradual here. Presentation is going to be vision loss, vision problem or vision loss. All right. So the patient is going to say that the patient has been experiencing this vision loss for about a year now, and for the last 3-4 months it's getting worse. So how are you going to approach this case? Like other scenarios, you have to go inside, you have to build a very good rapport. I'll make a separate video on how to build a good rapport and how to paraphrase different scenarios. All right, you have to build a very good rapport, you have to paraphrase. Now the patient is going to tell you that he has been having vision loss or vision problems. So how are you going to ask questions? So number one, of course, like every other scenario, you have to ask open-ended questions. And how are you going to do that? Can you please tell me more about your vision problem? Or you can say, can you please tell me more about this vision loss? The patient is now going to say, like, what doctor? Or he might say, he might tell you something, he might give you some information about the vision problem that the patient is having. All right. So after asking open-ended questions, the next thing you are going to do is OD para of vision problem or vision loss. Okay. So para. Okay. So onset. When did it begin? When did you first notice it? All right. Duration, and it's going to be long term, either a year, either 4-5 months, or 4-5 months, or even more than that. Okay. So duration, is it there all the time? Does it come and go? Progression, is it getting better? So you mentioned that you are having this vision problem for about a year now. So is it getting better, or is it getting worse, or is it the same? This is progression. Aggravating factor, is there anything that makes it worse? Relieving factor, is there anything that makes it better? Anything else? Again, this is your window to ask about red flags. This is your window to ask about DDs. Red flags, and DDs. So in every eye scenario, you have to ask about which eye, either one of them or both of them. You have to make sure. All right, you have to be clear about that. Apart from that, you have to ask if the patient also uses any visual aids, any vision glasses, any contact lens, or anything like that. Okay, do ask if something like that has happened before as well. So red flags, what could be the red flags in this case? The red flags can be, all right, let me just, the red flags can be GCA, the red flag can be stroke. So you have to ask these symptoms. Have you noticed any headache, any pain around your jaw, any vision problem? Okay. So if the patient explains to you about the vision problem, ask him, is it complete visual loss or is it blurry? All right. So then GCA, ask questions about stroke. Have you noticed any weakness in one of your body parts or around your face? All right. Now comes the DD part. DDs. So how are you going to ask that? So one of the features of age-related macular degeneration is, what happens in this is that it is central vision loss. The vision at the center is going to be lost, whereas the vision at the periphery is going to be completely fine. All right. So the patient is going to bump into things that are right in front of him. And the second most important thing here is that straight lines are going to appear wavy to the patient. All right. So this is one of the, you can ask this question in the DDs. All right. And you can ask about color vision. Apart from that, you have to ask about trauma. Have you had, did you hit your eyes, or did anything hit your eyes by any chance? All right. Trauma. Apart from that, cataract. The patient is going to be, because it's age related, of course, the patient is going to be 65 plus. So do ask about cataract as well. Okay, these are a few DDs that you have to ask. Glaucoma, you can rule out glaucoma as well. But now comes the meptosa part. So what are you going to do here? Ask about medical conditions, diabetes, hypertension. This will rule out diabetic retinopathy. Here you will rule out diabetic retinopathy, hypertensive retinopathy. All right. Do ask about hypertension, diabetes. Do ask about any medications, especially about steroids. This will rule out cataract. It won't rule out cataract, but of course it is a risk factor for cataract, right? So do ask about allergies, family history. Family history, there can be a positive family history in case of age-related macular degeneration. Do ask about travel history. Do ask about occupational history. Do ask about social history. So you mentioned that you are having this vision problem for about a year now. How are you managing your daily life? Oh, I'm really sorry. Be empathetic here. So because the patient is having this vision loss for about a year now, so of course he will be having some problems. So you have to be empathetic. You have to acknowledge. You have to try and find the solutions. All right. Ask about fever. All right, ask about fever, ask about DESA, diet, exercise, smoking, alcohol. After TDs and after red flags, you have to do eyes before examination. Okay, you have to do eyes. Can you please tell me, I'm really sorry, but can you please tell me if you have any other concerns? Do you have any other, I'm really sorry, but can you please tell me if you have any idea what could be the cause of it? After eyes, you will do examination. Examination. As I mentioned earlier, the examination in case of all the eye scenarios include visual field, visual acuity, all right, fundoscopy, okay, fundoscopy, and eye pressure, okay. So these are all the investigations that you are going to do, examinations that you are going to do, all right. So now comes the diagnosis part. Diagnosis. Now you have to explain the diagnosis to the patient, and how are you going to do it? So examiner is going to give you findings that you can see Drusens, all right, or he might show you a picture of Drusens, okay. So and visual acuity can be decreased, of course, okay. So that you have to do vitals as well, mention vitals as well. Nonetheless, you have to mention vitals, okay, in every case. So diagnosis, how are you going to explain the diagnosis? So based on what you have told me and based on my examination findings, I'm really sorry, but you are having a condition called age-related macular degeneration. What, doctor? Is it something serious? The patient can ask you that. Well, actually, let me just explain that to you, or explain what it is first, and then I'll come to that, okay? So explain it to the patient, be empathetic, because it's a progressive disease, right? So I'm really sorry, but age-related macular degeneration, or ARMD, is a progressive condition. It is a progressive condition, and the vision gets affected and it gets reduced over the period of time. What happens in this do you understand that? Check patient's understanding. I'm really sorry, I know it must be very difficult for you. Okay, it's done. Now you have to explain what it is, okay. As the name indicates, it is age related. So macula is the central part of the eye. Macula is responsible for central vision, the vision which is responsible for the things that are right in front of us. So what happens in this case is that part gets affected and a person is not able to see things that are right in front of you. Okay, the patient is now going to ask you about treatment options. So treatment options. So regarding treatment, we will be doing a few blood tests that include your routine blood tests, your complete blood count, test to check your liver functions, your kidney functions, ESR, CRP, which are the inflammatory markers. Apart from that, we will be referring you urgently to the ophthalmologist, who is an eye specialist. So it's an urgent referral. All right, guys, urgent referral. It's an urgent referral. So the eye specialist is going to perform a scan of the eye called OCT, or ocular coherence tomography, all right, and based on that test he will identify if it is dry type or if it is wet type. Okay, once the diagnosis is do you have any questions so far? Okay, no, doctor. All right, so after the scan they will diagnose which type is it dry type or is it wet type, okay. If it's dry type, I'm really sorry if it comes out to be dry type. There are no treatment options available for that, but we will be providing you with vision aids, magnifying glass, and we will have an occupational therapist to visit your home, and make changes according to your needs, to make your life better, okay. No treatment, keep this in mind, okay. If it's wet type, the eye specialist will discuss treatment options with you, and the treatment options include giving injections in your eye, into your eye. All right. Apart from this, I will also refer you to low vision clinic. Okay. They'll teach you exercises. They will help you to see from sides of your eyes, from here. All right, from here, from there. Okay, it's done. Okay, and I will also refer you to, and there is also a society called Macular Society. You can join that, and there are going to be other people like you. They will share their experiences. They will tell you, and you can also share your experiences that will benefit you as well. And dietary counseling, ask the patient to take vitamins, to take diet that is rich in vitamins, to take vitamin supplements. Apart from that, if the patient is smoking, tell them that we have help available if he wants to quit. and that's done. This topic is done now, and you can end this topic by doing, of course, safety netting, and give the patient leaflets. If your condition gets worse, if you feel unwell, or if you are not seen by the eye specialist, come back to us straight away. I will give you a few leaflets. And you can read about your condition in those leaflets. Thank you so much. Give me feedback. If you have any feedback, give me feedback. Tell me how can I improve this, and I'll see you again. Bye-bye.